Thank you very much. I'm Philippe Delespaul. I'm a clinical psychologist and have done a lot of innovation work in psychiatry, and also worked for the last 35 years in developing new assessment strategies in mental health that I will present here. Let's start with a starting observation. Assume that people living in a religious country are less often depressed. And that's a global epidemiological finding. What do we really know about this kind of assessments? We would unpack those assessments and think if within countries, religious practicing citizens are less often depressed, or do religious practicing citizens have more social contexts, which may make them less lonely, and loneliness is related to depression? Is that an issue that might be partly explaining this kind of relations? Is being alone related to lowered mood, and are religion-related social context more protective for depression than non-religion contexts? What I want to describe with that is that we often have global assessments, but we don't really know what the unpacking is and the factors that influence those issues. And I think that's an important way to proceed in research and proceed in understanding how people behave or feel or are emotionally connected. To be clear, all this kind of unpacking is often not understanding the causal relation. It's basically understanding the dynamics of how things occur. And our traditional assessment methods are insufficient to make this kind of assessments, to describe those patterns. So let's look at two psychological research strategies. The main topics of psychology are cognitions, emotions, affect, perception, and behavior. And if you look into those domains, most of them are private. Only behavior is a public observational, something that you can observe in a public field. And when you want to do research, you basically want to be able to cross-check the observations that you have, to minimize the bias and to improve the reliability. And traditionally, psychology has done that by moving into behaviorism, but we left that field years ago. But in cognitive psychology, we use basically narratives to access the private psychological domains. And trying to increase reliability and validity, we look into patterns that have consequences when people give us a narrative content, basically. So the public behavioral domain, how do people engage in activities? A number of activities are basically automatic behaviors. They might be inherited reflexes, but most of what we observe are learned activities with sometimes not even conscious awareness why people do this kind of activities. And often, especially in epidemiological data, you see the consequences of learned activities and behavioral choices that people made over time. They have stable activities, they decided for a specific job, they move to a different place. Those kind of aspects are relevant there. In intentional behavior, it's often consciousness processing, it's contextualized, it's motivated, and it's purpose-driven. I will say something about that in a moment. If you look at the domains that we assess from the narrative point of view, The traditional psychological strategy is understanding the narrative as a learned, interpreted consequence of experience. And that means that we also want to understand cultural norms. In the field of religion, those issues are important. Prospective new strategies try to find unbiased assessments in the private domain. And that means that we want to understand not what people think about their context, but how people actually feel in a context. So it's a dynamic assessment on the spot. That dynamic assessment on the spot that occurs in a normal ecological environment is basically correlational. People make selections about the environment they engage in, and those selections are based on their learning histories, their fears, their anticipation, and so on. So it's a selective situation and correlational by nature. And often we are not able to see how people learned those dynamics, but we only see the results of that. This kind of double pathway is well accepted, for instance, in the theory of emotions. We often think, and especially people working in the field of EMA and experience sampling, that observations in the daily life are basically validating observations that you do in cross-sectional questionnaires. Just to give you an example, when you ask people how they felt the previous week, pain assessment or an anxiety or depression assessment, we basically think and assume that that reflects how people would have experienced from moment to moment their mental state in daily life. What we've learned from this kind of methodologies is that those methodologies are basically supplementary domains of knowledge. People can have a self-narrative that says that they are anxious in public places, while they actually are relaxed very often in public places. But when you have a narrative that you collect with traditional assessment strategies, that narrative will guide people's choices and behaviors. So it's still important, if you want to understand the choices in behavior, to look into the narrative. If you want to understand the inner dynamics, you might look into the moment-to-moment experiences. The interesting part of the challenging part is that almost all psychological research up till now explore the narrative links, do not explore the moment-to-moment experiences. So how can we understand those mental states? Just backtracking a little bit to the basics of psychology. Basics of psychology is understanding behavior as a function of person and environment. That's the basic function. And over the years, we have optimized this kind of discussion by looking into behavior, affect, cognition, and perceptions as the B part of that function. Look into personality aspects, but also cultural background, genes, traits, traumas, learning history as the P part of that equation, and environmental aspects as the environment context, the physical context, but also the time context, what happens before, what happens afterwards, the inner context, what are the perception of stressors, what is the mental processing and this kind of issues, and then things as persons, activities, places, and time. So basically, this is the challenge of psychology, understanding all these kind of dynamics, and there's a lot of work to be done from that point of view. How do we approach that? Basically, we approach that by looking into developments into time. And the classic description of stimulus response with an organism in between can be also seen as snapshots in time that you assess over time. You have a description of a context, behavior, cognition, perception, and affect, and basically you see that a little bit later, some of those aspects have changed, and we want to understand what's happening intermediately to understand why that change occurred. Whether the context affects behavior, whether cognition affects perception, or whether perception affects behavior. This kind of issues is what we want to understand. So the change over time is something that is the basic of scientific data collection. And so we need sensitive assessment measures that allow us to assess this change over time. Once again, same iteration, you look into triggers that lead to more depressive states, but you look also into recovered triggers that move to less depressive states. That's what you basically want to understand. How does that dynamic work? Was a person alone here? Was he in a group? Later on, might that be one of the issues that create a pattern for this change? So we often look into the direction of antecedent control, but we also have to understand that most of the things that we learn and do is consequence control. Learning history creates an anticipation of consequences, which changes the way that people will act in a specific kind of context. So looking into the development of a better assessment strategy, it's interesting to search for unbiased subjective data that are sensitive to contextual change. That's what we want to do. And that leads to some...
to tell that within a few minutes, Philippe?
Yes, I'll finish in another 3 minutes. It's okay, yeah. So the design challenges are basically that we focus on normal daily life, that we assess places that are often not accessible for other people, or moments that people are not present, and we would try to observe there. If we would do that, it will often lead to biases. So the design challenges is, we want to understand how people feel in situation without asking them whether the situation affects them. So that's what you try to do, because all the other assessments that are part of the narrative description might be biased by the interpretation that people have. So getting rid of this kind of biases is very important. In this kind of strategies, you collect repeated assessments over a sampling level of subjects, but also a sampling level of moments within subjects. And each moment is assessed on the spot in the flow of daily life. That's what you try to do. If you look into this kind of family of methods, it was first proposed almost 70 years ago, but it's only become possible with information technology and smartphone apps that help you assess those kind of issues in daily life. These families, there's a lot of operationalizations and a lot of differences, but they all go back to a number of same kind of procedure elements. Assess daily life, use a time sampling algorithms, often use a random time sampling to avoid anticipation and situation selection, because people don't know well when they will respond. You need structural questionnaires that assess the different kind of dimensions. And the interesting part is that we often are able to collect 30 to 40 data bits in each moment within 90 seconds of time. And that's an important issue also. It doesn't give you enough time to make the interpretation. I'm alone now, so maybe that will affect my anxiety. No, we try to avoid that. That's what the method does. So it snapshots over time in different kind of situations, and that generates a film of daily life. And this film of daily life gives you a kind of unbiased assessment of how people actually live in the daily life situation. And that's an innovative data collection. I worked with that for the last 40 years, but then in that time, there was one publication in 2 years. Now you have almost 100 publications by month on this field. So it's really booming. And it's a paradigm shift, but a supplementary method in the unpacking of relations that we want to explore in research. Thank you.
Thank you, Philippe. Thank you for the straight introduction in the ESM method and also into his backgrounds. Is there a question for Philippe? And of course, when you attend online, you can put your questions in the chat. Maybe you can stop screen sharing, Philippe, then we can see you better.
Yes, I'll go back to yep. Yeah. Doesn't want. Oh, I have to do it here. Okay, thank you.
Nathan.
So
maybe it's nice when you come to the camera, then
okay.
We are small. Then Philippe can see who's asking the question.
Hello. Do you know if there are situations where the results from this measurement actually really clash with the self-narrative that the patient has of themselves? So can it also be a negative thing?
I don't know what you mean by a negative thing. It can be definitely different. So the assessment that people make of their own situation might be different from the assessment. The narrative assessment might be different from the moment-to-moment assessment, definitely. It can be confrontational, of course, but it's basically also, when you use it in clinical practice, it's basically unpacking. It's exploring relations and starting discussions, not disvalidating the responses of people, because the narrative is authentic and the moment-to-moment data is also authentic.